Hello, my name is Dr. Nasar Shahid. I'm interventional physiatrist, pain management specialist. I want to express my concern about so much chronic pain going on around us. In every family, there is somebody who has some kind of pain. Pain in the knees, pain in the hips, back pain, neck pain, elbow and hand pain and foot pain. So all these chronic pains linger with us. And at certain age, when we cross 50s, these pains come one by one. Even though we are going to gym, we are doing some activity, we have a walking program, still the pains keep on coming. And every time we go to doctor, he would prescribe some anti-inflammatory medication that is hard on our stomach and other organs. And if the pain does not get better, somebody is there to give some injection into our joints and muscles and tendons. So as a result, we are exposed to unnecessary chemicals getting into our body and redirecting our metabolic system. However, the problems are not solved because all these mechanical problems causing chronic pain, they have to be diagnosed at their basic fundamental grassroots level, and that is that we are not using our body mechanically in a correct way. So these biomedical defaults are at the root cause of our chronic pains originating from our joints. So I have been explaining to my patients about these. However, I found because of the time barrier and because the patient, when he comes to me, is already in so much pain that anything that relates to his habits, her methods, her lifestyle, they are not very much attentive to that. They want to get rid of their acute exacerbation of pain. So at that time, it's very hard to convey the message. So that's why I started this channel, so that all the patients and in population at large, they can listen to it and understand the grassroots basic mechanism through which the pain comes into our life and then never leaves us. In few of the vlogs, I'm going to first figure out and first describe those basic non-pharmacological modalities, methods, which are common to any kind of pain, like diet, what kind of food you should be eating and what you should be avoiding, like the sleep, which is the main healing time in our 24 hours, how that sleep should be patterned, how much sleep you need, what problems go into that sleep patterns, sleep quality, and then last but not the least, our physical activity. If in one sentence I can tell you the things that needs to be changed is our lifestyle. The modern lifestyle has its own diseases. Unless we change that, and what should be the target of change? That is the nature, the natural way of living. Since we are away from the natural way of living, we have these problems that gradually creeps into our body and then express itself with pain. Now, what is pain? In a simple words, pain is simple information to the brain that there is something wrong somewhere. And the area of the pain, the intensity of the pain, and its spread gives us an idea that what is wrong with that area. So I will go into details in specific pattern, but before that, few of my vlogs will be about the general information, the simple things that you can change in your life before you go to the specific part of pain relief. So the most important thing when we talk about relieving the mechanical pain is our sleep pattern. 7 to 8 hours of our sleep with good quality, uninterrupted, is the key to healing in our body anywhere. Whether it's a mechanical default or it's an immune system default or it's inflammatory default, the healing occurs best in the early part of the night. So, timing of sleep is important. So, the most important part of the night is the initial part in terms of healing. Initial part of the night. Now, the question arises when the night starts. Simply when the dark sets in, which is around sunset time. So after 2 to 3 hours. In winter it is 3 hours, in summer it's 2 hours. After the sunset we should get ready for sleeping. However, that is not easy in nowadays because we come from work, we have to eat, and then we go to sleep. So in my next vlog, I will mention specifically about some sleep hygiene tips that will help you sleep better. So that's one thing we can do non-pharmacological to get rid of chronic pain. So anybody who has any kind of chronic pain in joints, muscles, tendon, nerves, the first thing they should do for 6 weeks, change their sleeping pattern. No excuses. Change your sleeping pattern, and then you can talk about specific part. So the first 6 weeks for pain relief is to change your lifestyle in terms of sleep, diet, physical activity. And then we talk about the specific diseases, specific parts, specific disorders, what we can do, what kind of exercises are helpful, what kind of medications are helpful. In these vlogs, we will also mention the benefits and risks of any drug, any pharmacological modality. Also, we will talk about the physical therapy, chiropractor, acupuncture, all these different modalities which are non-pharmacological. And then we will also talk about more invasive procedures, including injections, minimally invasive procedures, and then surgical procedures. So this series will help us understand our chronic pain, how we can use these common sense knowledge to get rid of chronic pain. However, there is a disclaimer that this is not enough for a particular individual. Maybe your disease, your problem has many more dimensions to your problem. So few problems you can figure out from this activity, from using these modalities, these lifestyle changes. But then for specific disorder, you must see your doctor and listen to him and express your problems clearly to your physician. So if you like this series, please make sure you subscribe it, you give your comment, your experience about how much you are in pain and what helped you, so that we can have an interactive session through these vlogs. Thank you very much.